Good morning, everyone. We're going to let folks get into the Zoom room for a moment, and we'll start just momentarily. Good morning and afternoon now, everyone, to today's webinar, Engaging in Advocacy for Hispanic Latino Behavioral Health Equity, the Role of Advocacy in Promoting Behavioral Health Equity, with our presenter, Marilyn Sempillo. We are also joined by the organization HOLA, Healthy Opportunities for Latin Americans. This webinar is co-sponsored by the Great Lakes MHTTC and SAMHSA. The Great Lakes ATTC, MHTTC, and PTCC are funded by SAMHSA under the following cooperative agreements. The opinions expressed in this webinar are the views of the speaker and do not reflect the official position of the Department of Health and Human Services and SAMHSA. The MHTTC network believes that words matter and uses affirming, respectful, and recovery-oriented language in all activities. For more upcoming events and information, please follow the Great Lakes MHTTC on social media or visit our website. A few housekeeping items. If you are having any technical issues, please message me, Jen Winslow, or Alyssa Kuala in the chat section on your Zoom toolbar, and we will be happy to assist you. If you have questions for the speakers, please put them in the Q&A section on your Zoom toolbar rather than the chat. It helps us keep them organized. If you need live caption or live transcript, please enable them by going into the More section of your Zoom toolbar and select Live Caption. At the very end of the session, you will be automatically redirected to a very brief survey. Certificates of attendance will be emailed to all who attend this training in full. Please allow up to 2 weeks to process. And now I am pleased to hand this over to our presenter, Dr. Marilyn Sempillo.
Thank you so much, Jen. Really appreciate it. And thank you all for being here today. I'm very excited to talk about this topic with you all. And so I'm just going to go ahead and start sharing my screen here so that folks can see. All right. And I am going to put this in slideshow mode so that you all can see it. All right, perfect. So I'm just going to spend a little bit of time introducing myself, orienting us to today's session, and then the future sessions. As Jen mentioned, my name is Dr. Marilyn Sempillo. I have no conflicts to disclose, so no financial conflicts of interest for this presentation today. I am currently a pediatric psychologist working at Lurie Children's Hospital, so in Chicago, Illinois. Previous to this work, I was a licensed psychologist at Cleveland Clinic in their Center for Pediatric Behavioral Health, and that's a lot of where my advocacy work is through the state of Ohio, just because I just made this transition to Chicago in the last 2 months. So we're going to talk a little bit about the advocacy work in Ohio and sort of the ways that we were able to engage in advocacy work in Ohio as sort of the template for some of the examples that we'll be using today. I want to spend a little bit of time of giving you a little bit about my background. And part of that is because it helps inform some of the work I'm doing. It also allows me to be very transparent about where my biases are in terms of the work that I'm doing in the advocacy world. So I am half Latina, half Filipina. I think that's a little bit of my superpower. I love being bicultural in that way. I come from a family of immigrants and refugees. I'm a first generation college grad from my family. I was raised in Washington, D.C., and I have current advocacy roles in Ohio and Illinois. I think what's most important to know about this is because of my family's background and my background, I've had a lot of experience of navigating a healthcare system that frankly has been rife with a lot of challenges and difficulties. I've experienced it myself, but I've also really experienced it from the perspective of a loving, caring family member who just wants the best care for their family and sometimes really urgent and really scary conditions. And I've seen that healthcare system break down for them for a variety of reasons, whether it was due to language barriers, whether it was due to racism, discrimination. I've seen a lot of things happen in the healthcare system, again, both to me personally and to my family and people that I care about. And so it's been really important for me to use the privilege that I have as a licensed psychologist with a lot of education to really try and amplify the needs of our community, our Hispanic and Latino community, in terms of promoting behavioral health equity. So I want to just sort of give you an overview of what the series is going to look like, because if you registered for today's series, you might have also figured out that this is like the first part of a series. So there's a couple other sessions coming up. So I just want to kind of go over the overview of that series so you have a sense of what's coming. And if you didn't realize that there were other sessions, maybe help pique your interest in attending those sessions. So today is really the basics. We're just going to talk a little bit about why advocacy is important. You've heard a little bit about my story, but we're going to talk about it more broadly about systemically why it's important for our Hispanic and Latino community and why it's particularly important when it comes to behavioral health. And then we're going to talk about barriers to engaging in advocacy and what we know are facilitators. So a lot of people think advocacy is very like formal work. You go testify at like the state house, things like that. And that is a form of advocacy, but there's a lot of different ways we can engage in advocacy. And part of it is to try and help build people's confidence and build people's skills in doing that so that they can more comfortably engage in that work. Session 2 is where we really get into kind of the skill building portion. So we're going to outline key strategies for behavioral health advocacy and then figure out and talk about how do we help build capacity for that in terms of skill development. And then we're going to discuss advocacy action planning in the last session and then discuss examples of effective advocacy. So it really is a series where it's like built off the other one. The great thing about the series is I believe we're recording it, or we are definitely recording it. So if you miss a session for some reason, you'll be able to potentially access that material as well. And then key highlights of this series. This series is kind of unique because not only you're going to hear from me for a little bit, that's not the unique part at all, but the unique part is who we also bring on board. So we are partnering with some really fantastic organizations in the region who are doing fantastic work in terms of advocating for Hispanic and Latino families broadly. So different community-based organizations, different social service agencies who do a lot of work in supporting the community. And they're going to tell you a little bit about the services that they provide, but then also talk to you a little bit about what their experience has been in the mental health landscape in their organization. And then we're going to set the stage for an advocacy learning community. So what I do know about advocacy and in terms of working with a lot of folks about it is folks are more comfortable if they feel like they get a little bit more coaching or a little bit more instruction, a little bit more guidance on how to engage in advocacy. So we are setting the stage for another learning community where folks will get just a little bit more in-depth instruction and coaching on how to engage in advocacy effectively. So that just gives you a little bit of the overview. And so now let's get started. So every time I do a presentation, I like to try and start off with just an opening reflection for folks to kind of get us in the mindset of what we're going to be talking about today. So an ongoing reflection that I want you to just sort of think about, and you can use the chat to enter any thoughts that you might have, and feel free to share if you'd like to, is have you engaged in this advocacy work before? If yes, what kind of advocacy have you done? And if not, what makes you interested in engaging in advocacy now? So what makes you interested in even being on this webinar today? I'm going to just give it like a minute or maybe less than a minute for folks to just maybe throw in some answers into the chat. Again, feel free to share whatever you're interested in sharing, but just guided by these questions. Have you engaged in advocacy work before? If yes, what kind? And if not, what makes you interested in increasing your engagement now? And I can see the chat. So if there are any answers, I'll share them with the group. Margarita Jackson said, yes, health equity. So she's engaged in advocacy and it's been around the issues of health equity, which is really central to what we're going to be talking about today. And I'll wait just a little bit to see if anyone else wants to throw anything into the chat. Yes, around issues of immigration and education. Yes, at county and statewide levels, fantastic. Erica says they've been educating parents. The chat's going really fast, so I apologize if I miss anything. We have advocating for more inclusive procedures. I saw more local and state advocacy for substance misuse prevention, alcohol and tobacco policies, and yes, working on our school district equity plan. I love it. Thank you so much for sharing some of your work thus far in the chat. And what the chat's really highlighted is advocacy in a lot of different domains. We've seen like local district policy, state and federal levels, being a mental health advocate in just Lucas County, Ohio alone, educating parents, educating for students. And so a lot of different ways of engaging in advocacy. And that's really critical because, again, I think traditionally, a lot of folks think of advocacy as like related to just public policy or policy making. And advocacy doesn't necessarily have to be just that. Fantastic. Okay. And then what are you looking for? So everyone is coming to this webinar with a lot of different experiences, some really fantastic advocacy experiences already. So this is just to help me as we sort of move forward, because part of it is, yes, I've designed, the webinar for today, but I still have some ways to change some things moving forward for the next session. So this is just really to kind of help me figure out how can I best have your needs met. So what is the goal for today or for this series? What do you hope to walk away with from the series? What might help you move forward in your advocacy journey, and what might help you in your advocacy work? And again, very similar to the last question, if you have anything you'd like to share, please feel free to put it in the chat. Again, if there are specific things you're looking for, feel free to share them in the chat so that I know a little bit more about like how to tailor things to how you all want to learn and what you want to learn. Again, I have some ideas, but I'm always happy to adjust for the various audiences. So again, feel free to put in some goals. Again, we'll just do this for a couple of seconds. A deeper understanding and wider vision for how to support families within the health equity framework, what we can anticipate in the next 12 to 24 months. Fantastic. That's super helpful just in terms of like my thinking about this. And I really do appreciate thinking about like a strategic plan that's actually really going to be well tied into when we think about advocacy action planning and thinking about how we build one in the context of strategic planning. So fantastic. Okay. Well, thank you so much for chiming in on these questions, and we'll go ahead and get into the content. So objectives for today, I'm going to talk very briefly about my advocacy journey, so you just all know a little bit about what my experience has been and what I'm coming to this webinar with. Discuss advocacy as critical to social justice. So why do we even care about advocacy? Well, because it's very critical to social justice and equity. We're going to discuss barriers and facilitators for engaging in advocacy, as I mentioned earlier. And then again, we're going to get some insight from people who are doing this work in the field. So now let's really get started. So tell you a little bit about my advocacy journey. So I really started to engage in a lot more advocacy work when I got my first job as a psychologist. And part of it was I worked in a clinic that was predominantly serving a marginalized community, a clinic that had a large population of immigrants, a large Hispanic and Latino population, large refugee population as well. And part of it was really trying to understand the community in which my patients lived in, and really trying to make connections with the community agencies who helped the patients that I worked with. And so I did a lot of community outreach, just trying to really understand the landscape better and really trying to engage more with the community because, again, that's where my patients live. So in doing that community outreach, I had a lot of meetings with different community-based organizations, very similar to OLAW, which you'll hear about today, but had meetings with different partners, different community stakeholders, different community centers, different community organizations. In those one-to-one meetings, I was also able to sort of, explain what my expertise was, which is just, behavioral health. I'm a psychologist. What can I do in terms of better supporting behavioral health equity for this community? And those conversations were always very enlightening. Those conversations also helped me identify where advocacy priorities were aligned. So what were they concerned about? What was I concerned about? What were the patients and families I was working with concerned about? And how could we really maybe collectively start to advocate for some things that would better their experiences? So that led actually from all of that work, that led to actually me taking on a state level health equity role with the Ohio State Department of Mental Health and Addiction Services. I did that role for about a year. And then I moved back into basically being in the private sector. So I ended up moving to a different location in Ohio, moved to Cleveland for personal reasons, as well as I missed my clinical practice, frankly. And so went back to being a employee in the private sector working at a large hospital. But I had already established a lot of different connections in terms of advocacy and public policy work. And so I actually took on what we would call like behavioral health advisory roles with a very particular entity. It's through the governor's office in Ohio. It's called the Ohio Commission for Hispanic and Latino Affairs. And I was really able to basically sort of carve out a behavioral health or largely more health advisory role with that particular organization. So I stayed involved in advocacy and public policy for our Ohio Hispanic and Latino Ohioans. And so that's really where my advocacy journey has taken me. I have now pivoted in my professional life. And so I'm now in Chicago, where I'm the director of behavioral health services for an all hands health network. And the all hands health network is basically collaboration between Lurie Children's Hospital and various community-based organizations and various community-based primary care practices to better the lives of children within some of Chicago's most underserved and under-resourced neighborhoods. And so that role involves advocacy and trying to influence policy as well. And so this is something that has allowed me to continue that journey while also still providing some of that support to my colleagues in Ohio. And I tell you just a little bit of my journey so that you have a better understanding of sort of what I'm coming to the table with. These are just some of the examples of some of the advocacy work I did in Ohio. We published some community reports, some policy briefs. We developed a regional community health navigator system. And then we developed an Ohio Latino Mental Health Network, which is a collaboration across individuals across the state of Ohio who focus on providing behavioral health services to Hispanic and Latino families and trying to provide more professional support, a sense of community, and frankly, a forum for collective advocacy. So again, just some highlights there. In thinking about Hispanic and Latino families, we really have to think about like why. Everyone on this call knows that there's significant behavioral health disparities. I don't need to go into that. I know you all are well versed. You see it every day, and you have a good understanding of just the state of behavioral health disparity or mental health disparities among our community. What I'm just going to briefly go over is sort of the why we engage in advocacy. Frankly, the reason that we want to engage in advocacy is because those disparities, the factors that drive those disparities are things that we have to address through advocacy in order to promote change. So I just want to kind of go over briefly and review some of the factors that influence the behavioral health or rate of behavioral health disparities that we see. So there are 4 different sort of domains I like to think about: individual factors, provider clinician factors, systemic institutional factors, and then structural factors. So when we think about the why, so why do we want to engage in advocacy? Well, we want to make sure that individuals also know what their rights are and what they should feel empowered to ask for or engage in. And part of that is also trying to be attentive to individual factors that influence behavioral health engagement. So what as a person's prior experience been, right? If I have had a really terrible experience in the mental health system, I'm probably less likely to engage in that system moving forward, right? And that actually has been the experience of a lot of the patients that I've worked with. They would tell me about experience they've had or significant challenges accessing those services, and that being one of the reasons that they don't necessarily engage in the system. It can be also, individual factors can also be beliefs about mental health care, which is something that I think we focus on in terms of educating and trying to really reduce stigma broadly in the community. We also think about patient preferences, just in terms of how would you like to receive behavioral health care, and sometimes we don't necessarily, as much as we should, we don't necessarily attend to maybe those factors. When we think about provider clinician factors, sometimes factors that create or help, or not help, but create some of those disparities or increase some of those disparities is lack of appropriate training and tools. So some providers feel ill-equipped to work with communities, a variety of communities or communities from diverse backgrounds. Providers may have a lack of multicultural competence. Unfortunately, that's also something I would hear from families in terms of talking about their poor experiences navigating the behavioral healthcare system. And just like all individuals, providers are individuals themselves. And so they may come to their encounters with bias, or patients may experience discrimination from providers as well. And so we have to think about how do we advocate to address these factors. We also have to think about the systemic and institutional factors. So really what we're talking about here is accessibility, availability, affordability, and acceptability. So accessibility, that would be just, can you access behavioral health services? And truthfully, that can be a significant challenge for a lot of families. One of the reasons we created the Community Mental Health Navigator System in Ohio was because of the overarching understanding that a lot of our families would experience point of contact barriers, even just trying to engage in the system. So what I mean by point of contact barriers would be even just making that initial point of contact was challenging to even try and get into the system to make that first appointment. So if you think about like an experience that a lot of my families had is they would maybe go to their doctor, they would complain of a behavioral health concern for their child. And the doctor would maybe give them a list of different behavioral health agencies in the community. Well, you imagine how difficult that might be if a parent has limited English proficiency in terms of contacting all of those folks. So that in and of itself is going to be a barrier to making that point of contact. When you do call, then you also have to think about, do they take my insurance? And so some agencies may not take their insurance. Some agencies, some individuals may not have insurance. So that obviously closes the door in terms of options. You may find that an agency takes your insurance, but it's not located nearby. It's actually 40 miles away, and you won't be able to necessarily obtain the necessary transportation to get there, right? So access to services can be a problem. Availability of services can be a problem. We are all well versed in understanding that currently we are in a behavioral health crisis. It is a crisis that has been around for several years. It was only actually exacerbated by the COVID pandemic. But what we do know is there were never enough providers for behavioral health care before the pandemic, and there certainly aren't enough now when the demand is greater. And when crises are exacerbated, the communities who suffer most are the communities who have been disproportionately impacted by those factors. And so our Hispanic and Latino families are facing even bigger hurdles to try and engage in a behavioral health system that is already strained and already ill-equipped and frankly ill-prepared to deal with the excessive demand that we have. Affordability, as I mentioned, Hispanic and Latino families do have a higher rate of being uninsured compared to other demographic groups. And that is something that creates a barrier for a lot of individuals in terms of obtaining necessary behavioral health care. We focus a lot on early identification and intervention and really trying to catch things early. But if you don't have the ability to access care because of lack of insurance or lack of funds or financial issues, then basically we sort of wait until things become crisis or things become urgent before they probably will be able to receive healthcare. And so you can see how that perpetuates that longer gap for individuals. And then acceptability. Do we have a behavioral healthcare system that provides services in a way that is acceptable to these communities? So in a way that is culturally competent, in a way that is linguistically appropriate. And that's not the case all the time. Even with institutions that I've heard or agencies that I've heard that provide not bilingual services, but provide interpreter services. Sometimes even those systems aren't enough to meet the needs of a limited English-speaking population. And then we have to think about structural factors. So these are the factors which govern and hold up our current systems. Frankly, behavioral healthcare system, which everyone, or not everyone, but a lot of people will say is broken, frankly. But there are things or structural factors that sort of create a system that isn't built for everybody and that a broken system won't be able to address. And so how do we really think about creating change? And the way that we create change for structural factors is a lot through advocacy as well. So I want to just sort of provide, again, this metaphor for, again, why we want to engage in advocacy. So everyone's very familiar that the social determinants, or sometimes called social influencers of health, sort of fall in these general domains. And you can see with this little figure, everything looks healthy. If everything is healthy, the leaves are green. So this is trying to insinuate that these social determinants or these social influencers of health are in good shape, if you will. Well, but the fact of the matter is we have to look at not just the social influence, but frankly, what's in the soil, what impacts or what influences those social determinants or social influences of health. And what we know is that in the soil are really sort of the structural factors, the systems of oppression and the social hierarchies that exist that sometimes create unfair systems or create systems that don't work for everybody. There's actually a model that sort of looks at this notion more deeply related to mental health. And so Compton and Shim created this great model, basically the social determinants of mental health. And really what they're basically emphasizing is it's this unfair and unjust distribution of opportunity that really sort of poisons the soil, if you will, that does not allow individuals to thrive when it comes to those social determinants of health, and then result in things like behavioral risk, adverse mental health, high physiological stress responses, high inflammatory responses, and psychological and psychosocial stressors. So just sort of thinking about why we sort of look at this from a wide lens in terms of advocacy and policy. And so when we think about this more closely, it is that part in the red where we're really thinking like that's where we need to try and enact some change, because it's the soil. If your soil is not healthy, if your soil is, I don't know how many gardeners we have out there attending or who likes to really work outside. But I have a family member who loves to spend their outside time in the garden. And they always talk about making sure that the soil is healthy, because if the soil is not healthy, nothing will grow. You can water it, you can give it lots of sun, you can do whatever you can possibly, and you can take the most cultivating care of a plant that you can. But if the soil is poisoned or is unhealthy, nothing will flourish. It will not thrive. And so the question is, how do we enact change to ensure that these policies and practices and norms are better, are more just or more equitable in terms of the systems that they create? So just as an example of this, so if we think about structural racism as one of those factors kind of in the soil, we would like to think of like that as a form of structural violence. So the reason that structural racism is a form of structural violence is because policies and procedures and norms and all of those things which are in the soil, they don't just passively exist. They can, if not rectified or not addressed, can cause harm by being inequitable in sort of the systems that they have developed. So when we think about structural racism as a form of structural violence, it then causes impact or harm to things like health, education, and immigration. So for example, health, it will have a negative influence on access to services, on quality of services. In terms of education, we know that Hispanic and Latino children are more prone to experiencing effects of what we call the school to prison pipeline. So basically increased discipline or in excessive discipline that sort of leads to encounters with law enforcement through school. And we know that for like schools that in terms of the distribution of resources in schools, if they have like a 90% population of children of color, they actually spend less money per student compared to schools that have a lower percentage of children of color. So I think it's like $733 less per student. And so again, it's sort of resource allocation, resource distribution. We know that schools in inner cities where more Black and brown children live do tend to have larger class sizes, tend to have poor resources, and tend to have more challenges in terms of education. And then we know that structural racism can impact immigration, create a harmful impact on immigration, whether that's through immigration enforcement or the criminalization of immigration, criminalization of immigration as well. We also have to think about the current environment. So again, why is advocacy important? Well, in the current environment, we have a lot of evidence for, or a lot of examples for why this is actually critically important right now. There is significant anti-immigrant rhetoric and discourse going on. There's movement in terms of anti-immigrant policies initiatives. For example, SB 4, I believe in Texas, which folks are worried about could lead to more like racial profiling for determining whether someone might be crossing the border illegally, is sort of how they've termed it. I believe that is currently in a hold, but that is a policy that is they're trying to move forward that has potential negative implications and ramifications for our community. We know that there's anti-DEI policies initiatives being kind of propping up throughout the country, some much further than others. As I mentioned, I previously lived in Ohio, and there are current bills moving through the Ohio legislature when it comes to trying to limit discussion or discourse around DEI. We also know there's anti-LGBTQ plus policies and initiatives, and we know that in our Hispanic and Latino community, our Afro-Latino and our LGBTQ plus community members really are experiencing quite a bit of negative backlash as a result of some of these policies. So even in the current landscape, so we think about what we know and understand about structural influences on health broadly, plus our current landscape is sort of an indictment, if you will, or sort of an example of why this is really important and what that can go into that soil. These policies, this rhetoric, these initiatives are part of that soil potentially. We also want to know, or we also want to address what our Hispanic Latino families themselves are experiencing and our community members are experiencing. So recent data within the last couple of years says that roughly half of Latinos have personally experienced racial discrimination in some form, shape, or another. Roughly 6 in 10 of Latinos say not seeing racism where it actually exists is a bigger threat than seeing racism where it doesn't exist. So again, just sort of that idea of we care about racism, we care about the impact on our community. And roughly 7 in 10 of Latinos say individuals experiencing poverty have more obstacles in life compared to others. So again, that perspective of trying to engage and trying to navigate systems when you're experiencing poverty or of low income status, how much more challenging that can be. So even from just listening to our community, what they've experienced, their perceptions, it's important to understand why advocacy is important, even from, again, their lenses. So second, the what, or the language. So we just want to make sure that we're using the same language to sort of discuss some of these core issues. Again, this first session is sort of setting the foundation for our next sessions. So equity, when we think about equity or inequity, we're really thinking about the differences resulting from what we think are avoidable, unfair, unjust, and preventable barriers or challenges. And I think, again, what's key is what is highlighted there in the red is that these are avoidable, unfair, unjust, but sometimes we haven't just made the changes because there's not enough collective will to try and remedy or rectify these situations. But these are barriers that are avoidable that then tend to limit or constrain the opportunity for individuals to be as healthy as possible. On the flip side of that, health equity is basically the opportunity for everyone to live the healthiest life possible, or that they are possible by addressing and being able to avoid inequalities, historical and contemporary injustices, and elimination of those disparities, right? So that's really what we're sort of aiming for, is being able to have health equity for all communities, all populations, and obviously the point of, or the focus of this learning series is on for the Hispanic Latino population. When we think about social justice, we really are just sort of thinking about equal rights, equal access, equal opportunities for individuals regardless of background. But I really like this definition that Dr. Atterbury Ash created or sort of developed. One of the things that, one of the reasons she developed this definition was because there are so many different definitions of social justice that exist. In preparing this presentation, I was floored by how many different definitions of social justice exist. All of them have things to offer. All of those definitions are incredibly important and are helpful. However, it's hard to really help galvanize people around this issue when we don't have a common definition. This is not the most commonly widely held definition. It's not the most used definition, but it is a definition that I particularly like because I do really think it captures, and it comes from her experience and frankly her perspective as a social worker, right? And so that's again what we're really focusing on, is how to engage more folks in the behavioral health world to engage in more advocacy. And I think this definition, from the perspective of a social worker and the perspective of our different like codes in social work or psychology, the codes that sort of govern our fields, really does promote us trying to better the lives of society, better the lives of individuals. And I think this definition of social justice helps put us on an even plane when we think about that. Some people confuse the words advocacy and activism or use them interchangeably, but they are different. So advocacy is more any action that pleads or supports, defends, or speaks for other people or on behalf of a cause. Some people like to think of advocacy as working within a system to try and create change, or working within a specific domain to try and create change. Activism is more about taking direct action to achieve broader social or political change, and that can sometimes be considered like working outside of a system to push them to make that change. So if you think about Black Lives Matters, that's a sort of community organizing source of form of activism to try and push larger social and political change, whereas advocacy could be what you're doing within your own agency, within your own institution, within the state of Ohio, in terms of trying to advocate for different funding sources for behavioral health and things like that, working within that system. So why is this important? So why did we just spend a lot of time talking about advocacy or factors that influence health disparities, advocacy, and then social justice? Well, because we want to think about advocacy in context. Advocacy is the way, if we recall the definition from Dr. Atterbury Ash, advocacy is the way to basically foster social justice. It's a way to be able to promote a just system, a just approach, and just processes and protocols so that individuals can be as healthy as possible, or in the context of mental and behavioral health, they can lead their most healthy lives when it comes to being mentally well. And so that's how I want us to just sort of think about it, is that you can't really have social justice without advocacy. They sort of go together. So poll question number one, which of the following represents a primary barrier to engaging in advocacy? So A is I don't know enough or feel ill-informed to engage. B is I don't feel like it is part of my role in my professional world. C, I don't have enough support to engage in advocacy. D, I don't have the skills necessary to engage in advocacy. Or E, other. Which of the following do you think represents a primary barrier to engaging in advocacy? You can just throw your answer into the chat, A, B, C, D, or E, and I'll just kind of see what we get. Got E, got C, more C's, E, C, definitely see a lot of C's and E's. Good job, guys. Got some D's in there, A's, E's, C's, A's and C's. Perfect, awesome. Thank you so much for doing that. Still looking at some answers coming in through E's and A's. Okay, so I think maybe the one answer I didn't see a ton of is B, but everything else, I saw quite a few of them. One, it's awesome that I didn't see a lot of B's because I hope that folks feel like it's part of their role. But I would understand if you don't feel like it's part of your role. Frankly, I was never trained in advocacy. I was never trained in social justice or anything like that in my pursuit of my PhD specifically. I didn't get specific social justice training or specific advocacy training. So I can see why some people might say, well, I'm not sure that that's part of my role. Maybe that's more for lawmakers and legislators or what have you. But I'm glad that that's not been a predominant answer here. This is a little bit of a trick question because the answer is frankly all of them. All of them are primary barriers to engaging in advocacy, at least in terms of what research shows. So what we know about the research on this, and luckily, there's been some research on barriers and facilitators of advocacy. We know that there's a couple of different common barriers. One is resistance to change. So that's thinking like leadership would be resistant to change in general. So it's almost like a learned helplessness. Well, why even bother if they're really not going to make change, or why it won't really matter in the long run because they're going to be less likely to engage or catalyze any kind of change. So resistance to change. Lack of knowledge. So folks may feel like they don't have the knowledge to engage in advocacy in an effective manner. That's part of what I'm hoping with this learning series we can try and decrease is the knowledge, leverage the knowledge you already have. And that's going to be one of the secrets of this learning series is the majority of what I'm going to talk about, you're probably already doing, or you probably already have that skill. You just maybe don't think about it that way. Institutional barriers. We all have different agencies or institutions that we work with, and sometimes there may be barriers to engaging in advocacy. So, for example, there are real factors to consider when it comes to how do I engage in advocacy as a psychologist. I'll just use myself as an example. So, as a psychologist, how do I engage in advocacy? I have to know what I engage in as a private citizen, and I have to know when I engage as my professional role. And do I represent myself, or am I representing my institution? And if I'm engaging in advocacy, does it reflect poorly on one way or the other? So there are things that we have to consider, and sometimes those are examples of institutional barriers to engagement. And then limited resources. So feeling like maybe the resources and the supports necessary to really push for and advocate for a change in something is limited or is not present. Limited time. We are all very busy individuals. Again, I noticed not many, if at all, individuals said that B was one of the answers. It's not part of my role. So everyone feels like it's part of their role, but we also have limited time in our day, right? I wish if I was watching Aladdin over the weekend. Everyone's familiar with Aladdin, the movie. I was watching Aladdin over the weekend, the live action version. And the genie was granting wishes. And I was just thinking, if I ever came across a genie, what wishes would I grant? And what wishes would I ask for? My first wish was just more time. I just need more time in a bit because there's so many things I want to do, but I don't have enough time. Pretty much highlights that point is we all have a lot of things that we're trying to do, a lot of things that we need to engage in on a daily basis as an individual, as a family member, as a friend, and as a professional. And we may not always feel like we have enough time to engage in some of the advocacy work that needs to be done. Interpersonal struggles that could be reflected to, or that could be, I'm struggling with this particular issue. It's important to me in this way, but I also recognize that maybe there's points of views for the other perspective, or maybe I'm struggling because I really want to advocate for this, but my institution is advocating for the opposite. And so just those interpersonal, internal conflict that you might have about engaging in advocacy for any reason. Conflicting agendas. Generally, advocacy, we're going to talk a little bit about how do you create, how do you engage in coalition work? How do you bring more people into your cause? Things like that. But sometimes when we do that, everyone is different. Everyone comes in with different perspectives and experiences. And while you might all want to be working on health equity for Hispanic and Latino communities broadly, right? Everybody on this call is interested in that. We might all have very different agendas in terms of like, what are we specifically trying to accomplish? And so sometimes those agendas can come into conflict. Again, everybody wants the same thing, but how they want to go about it or how they want to achieve it might look different. And depleted emotional and physical reserves. Advocacy work is hard. That is one thing that I can say for sure, is that it's hard. It can be challenging. It can be draining. Sometimes the outcome is what we want to see. Sometimes it's not. And that can be demoralizing in certain ways. And so it does take a physical and emotional toll, just like mental health work does. And so for us, people on this call who are very interested in mental health and might be even working in mental health and trying to advocate, that can definitely take an emotional and physical toll on folks. All right, poll question number 2. What do you need to be more comfortable to engage in advocacy? Do you need more knowledge about issues? Do you need more guidance and or mentorship? Do you need more training or skill development? Or do you need more resources or support? If you had to pick one of these, and again, I recognize that it's not an exhaustive list. I didn't have everything outlined here. But if you had to pick one of those, what would you pick? I see some A's, I see some C's, I see B's, I see D's, C, more skill development. And thank you all so much for participating. I know you, again, this is like the lunch hour for some of you, if you might be like in the middle of doing other things too, but I really do appreciate your active participation with these. Awesome, perfect, okay. Thank you so much, E, all of the above. Yes, I thank you. I appreciate, I should have had that E as another option or all of the above. So thank you so much for answering that. My hope is that over the course of the series, you'll actually get a lot of that. So you'll get some of those, what do you need more of? You'll get some of that throughout this series. And part of the reason that those were the 4 choices is because we know that those are facilitators of advocacy. Research sort of bears it out. If folks perceive that they understand advocacy and policy better, they tend to engage more in advocacy work. If they tend to perceive their skills as being competent, whether that's, and that's across domain, so that can be your communication skills, your interpersonal skills, your writing skills. If individuals perceive their skills or perceive being well equipped with those skills, they tend to engage in more advocacy. If individuals tend to perceive that they have more resources and support for engaging in advocacy, we're going to talk about maybe how do you build more support for that. That is one thing that can facilitate advocacy. And if folks really feel like they have sources for collaboration and community involvement and community engagement with their advocacy, that tends to also facilitate engagement in advocacy. So we're going to talk a little bit about how do we build some of these. But again, I want everyone on this call to think about this idea that you already likely have all of these skills in some way, shape, or form. It's just a matter of thinking about them in the context of advocacy. And if we maybe don't feel confident in some of these skills, hopefully by the end of this series, we'll increase some confidence in some of these skills. And the 4th is the community, the people, the who. I would be remiss if I did not talk about advocacy and also just try and focus a lot on and mention that we always need to make sure that we're prioritizing the community that we're advocating for. So what is the cause or issue that's most salient to the community or your people of interest, right? So I might see an issue, I might see an urgent mental health care issue that I want to advocate for, but that may not be what the priority is for the community that I'm working with, right? And so if, I see a need, I can advocate for that need, certainly, but I also want to make sure I'm prioritizing the needs and what is most salient to the community that I'm trying to advocate for on behalf or with. And what does effective advocacy look like to that community, right? So when it comes to health equity for Hispanic and Latino populations, there's a lot of research on what Hispanic and Latino communities would like to see improve when it comes to behavioral health care. And I'll use some of that to guide the work, but not every Hispanic and Latino individual is representative of every Hispanic and Latino community. And so what I would argue for you all is to, think about your local community, your local Hispanic and Latino communities that you work with. What does effective advocacy look like to them? And those are questions that we should be asking them, and asking either the community members directly, community stakeholders, or organizations like OLA, which you're going to hear from in just a few minutes, in terms of what does that look like. And what benefit will your advocacy confer to the community or people of interest? Again, my goal with this slide is to always remember that we're centering the community, we're prioritizing the community when we're talking about any of this advocacy work. Because at the end of the day, advocacy is a long journey sometimes, depending on what you're trying to do. And sometimes I think, you know, from experience and from just what I've heard from other folks who do this work, sometimes you lose sight of the really important piece of like centering the community throughout the process. So just a reminder of like why, how, and then for who are we doing the advocacy work. So these are just some references. Again, this was just an overview, an introduction to try and get us set up for the next session. But again, what I really like about how the series is set up, and I'm really going to credit Dr. Isabella Echevarria for trying to design an advocacy learning series that not only provides training and professional development, which is like my pieces of it, but then also really training professional development from people with boots on the ground doing some of that good work. Yes, I do some of that work, but also these folks are doing it day in, day out with their various communities. So it's important that you all hear from them as well. So what we're going to do is I'm going to go ahead and stop sharing. I'm going to pull up Ola's slides. They're going to introduce themselves, tell you a little bit about their organization and their kind of mental health perspective. And then at the end of their session or end of their part, we're going to just go through the Q&A box. So if there are any questions after my slides, after Ola's slides, please feel free to throw those questions in the Q&A box, and we will have some time at the end to address some of those questions. All right, so I'm going to stop sharing real quick. I am going to pull up your slides. Scroll this way. Okay. Go to slideshow. And then I'm going to mute myself, but Ruben and Diana, when you just want me to switch slides for you, you just say next slide.
Thank you. I appreciate that. And thank you for inviting me, Dr. Sampillo. It is a privilege to be here. And we represent organization HOLA, which means Healthy Opportunities for Latin Americans, Oportunidades Saludables para Latinoamericanos, the ones of you that know Spanish. And next slide. HOLA is a 501c3 tax-exempt organization that serves as a vital bridge connecting the Latino community in an 8-county area of central Wisconsin by improving access to healthcare, community services, and legal resources. Our commitment lies in promoting economic advancement and civic engagement for workers and families from Latin American countries. We serve 8 counties: Marathon, Wood, Clark, Lincoln, Langdale, Portage, Taylor, and Shawano. Next slide, please. And that's me. My name is Ruben Silva. I'm Brazilian by birth. Grew up in Bolivia. Did my university studies graduating from theology in Rio Grande Bible College in Edinburgh, Texas, and have a master's degree in pastoral counseling under Liberty University, Virginia. I'm working as health service coordinator in Abbotsford, Wisconsin, under the organization HOLA, WIPS, and H2N, serving more than 300 families in the area, connecting them with resources that are available through their counties and nonprofit organizations. One of those resources is the food pantry that is done once a week at the St. Bernard Catholic Church in Abbotsford, Wisconsin, which I am deeply involved. Next slide, please. Okay, so going back to our focusing areas, the first is family support, then healthcare assistance, then legal assistance, and community. Next slide, please. Yes, on family support, we give assistance with interpretation and translation. We provide language support to bridge communication gaps, ensuring individuals and families can access services effectively. Resource navigation. Our team educates families and local resources, empowering them to thrive from food and clothing to housing and education. We guide them through available options. Job seeker support. We connect individuals seeking job opportunities with relevant resources and networks. We also assist individuals with completing job applications. In referrals to other nonprofits, we offer information that give referrals to local nonprofits and service providers, including ESL classes, transportation, and licensing service. Next slide, please. Yes, this is the food pantry that we realize every Thursday, weekly, for families that are in need of food, and also on other services like baby supplies. And this is like an advertisement of that food pantry, and it have the location and where it is, and yeah, dates on it. Next slide, please. Also, this is an advertisement or of like free or pro bono English as a second language classes, ESL. This is realizing on a church in Marshfield every Tuesday, and there is another one that I didn't put this slide that is realizing Abbotsford too. Next slide, please. Okay, also, we do set up tables on events like Cultural Fest to talk about the resources they can have through organization, OLA and H2N. We do free blood pressure and diabetes tests along with vaccines, COVID-19 prevention, flu, and others. We also give them free COVID-19 home testing, thermometers, face masks, etc. Next slide, please. Also, we give healthcare assistance, like we have bilingual navigators or Spanish-speaking navigators assess eligibility for health coverage options, such as Marketplace and Badger Care, Medicaid. They assist with enrollment forms and healthcare access. Also, we do resource referrals. We connect individuals to free clinics, sliding scale free clinics, and reproductive services. We also assist with referrals for substance abuse, domestic abuse, and mental health concerns. Suicide prevention training, or Question, Persuade, and Refers QRP program focuses on suicide prevention with the Spanish-speaking community. H2N outreach program, efforts extend to the Hmong and Hispanic community to promote overall wellness, highly impacted the health and financial well-being of both groups by the COVID-19 pandemic. Next slide, please. Okay, and this is something we do once every 2 months at the same place of the food pantry. And we offer through the county and nonprofit organization those services once every 2 months in Abbotsford: immunization, pregnancy education week, diapers and wipes distribution, infant safe sleep, car seat safety checks, reproductive health services, vision screenings, blood pressure screening, diabetes screening, water testing information, oral health screenings, and fluoride. And all of those services are pro bono, are free for the people who comes. No questions asked, they come and they are served. Next slide, please. And this is the WASA Free Clinic, who serves primary care medical services in WASA, also for free. And we will talk about the behavioral health service they provide too now. And we will talk about that later, but this is just a mention that WASA Free Clinic does a great service, pro bono health service for our Hispanic and, people in need, general, not just Hispanic. Next slide, please. Okay, now we'll talk about mental health and AODA resources that we connect persons with. Diana and I, we do the same job, like we connect people with resources. I do that in the most for the Wood County and Clark County area, and Diana most for Marathon County, which is WASA. So next slide, please. Yes. I'll talk first about Family Health Center. They do the AOD services, alcohol and drug recovery services, and they do that pro bono after assessing the incomes of the family. Okay, they offer therapy, counseling, outpatient medical services, primary care, social workers working with the patient and the family to achieve goals, financial advisors, patient navigators, helping patient finding coverage or financial assistance. Okay, next slide, please. Also, Family Health La Clínica, they have like a bus, a mobile unit for migrant seasonal workers, okay? And they accept different medical insurance and also do services pro bono. Next slide, please. Okay, the Stevens Point Behavioral Health Clinic also is a great blessing for people, low-income people that don't have insurance and need to be connected with a behavioral health professional. And we do connect them with them, and they first do an appointment with a specialist on, navigating through the financial situation of the patient. And then they schedule the appointment and give the patient the opportunity to do a fair payment plan or a free consultation depending on their poverty level. Next slide, please. Yes, and this is an app that help people that needs counseling through psychologists, and it does in English and Spanish. Those are made through internet or an app, and they can also choose their doctor, and they can, like, when they are searching for a psychologist, they can choose like what kind of language they want, like English or Spanish. If they want English, on the screen will appear only the providers that speak both languages, that are bilingual and can do the consultation in English. And the good thing of that, they don't ask for medical insurance. The first consultation is $20, where the professional, like with the patient, they make a plan with goals for the patient to achieve and the treatment plan. And then the other appointments that come after that, they are $49 each, which is very cheap if you are considering the prices that a professional in the behavioral health department charge in a regular clinic here in USA. Next slide, please. And this is more of the images that you will see if you install Sanarai app in order to schedule an appointment. And through some questions, they will suggest some professionals that can help you according to the mental issue you are facing. Okay, so next slide. Okay, the Compass counseling in WASA, those are more for people that have some kind of insurance, like Medicaid or Badger Care, and we connect them with that counseling place if they have that kind of insurance. And we first assess our client that is calling us what kind of insurance, or if they don't have any insurance. But this is one of the cool places that we can connect them with, for them to schedule an appointment, because it's not just behavioral health, like it's like marriage counseling, and also like drug recovery counseling, and like an appointment that can help a person that is facing depression, anxiety, and all of those issues. Next slide, please. Okay, now let's talk about the WASA Free Clinic mental health services. When a person doesn't have insurance or is very low income, and it is on the poverty level or close to the poverty level, we definitely connect them with WASA Free Clinic. Why? Because they have a variety of services, not just primary care. They also have mental health service. They have Spanish-speaking therapies, telehealth visit, and free services for regular patients. So when they admit the patient, they assess the patient, and if the patient needs behavioral health counseling, they will connect the patient with a screen if they don't have that specialist. And this is all pro bono. This is all like free of charge. And this is great. WhatsApp Free Clinic is sponsored primarily by the Presbyterian Church in Wausau and is ready to receive a patient. We actually help the clients that call us to schedule appointments there for behavioral health appointments. Next slide, please. Now I will introduce my colleague, Diana. Diana, you may speak.
Hello, my name is Diana. I was born and grew up in Peru. Hello, can you hear me? It says my connection is not stable.
I can hear you,
I
Diana.
moved to Wisconsin in my 30s. I have one child. I have experience in education and customer service. I went to UWSP and studied communications and education. I've been working as a community health worker since 2023, and I enjoy learning about new resources and sharing them. Please, next slide. Okay, so I'm going to speak about some of the things we do. So we try to help people when they're looking for a job or they're trying to find an educational opportunity. So that is included in family support. We have a list of jobs also, or we also write when we hear of a new job, word by mouth. And this type of support is very important for our mental health, especially when people listen to their native language in Spanish. People can be down when we don't have a job, and then knowing that somebody speaks your language and is listening to you and tries to help and providing support is good for our mental health. So we try to encourage people, and we do referrals of places where they can get more help to look for a job. For example, we have the job centers, and the job center in Wausau, there is help in Spanish also. And we have the McLeach, where there is help to learn English, driver's education, and career development. And one of the problems is that many people don't have the right documentation, so that makes things harder to find a job. But we try to help, as best as we can. Next slide, please. So for legal assistance, it's mostly right now referrals of lawyers that don't charge much, and immigration support, and employment law and benefits. So it's mostly referrals where we are doing. We have a free legal clinic here in the Wausau area. Other places, they offer that. We help people, I help in making, we can help making appointments for the free legal clinics. Next slide, please. So another way we help our community is organizing community activities and cultural activities. We partner with other organizations and schools to celebrate and foster understanding of cultural themes through music, dance, and art. So here there is a website, and I don't think we can open that right now, but it's in the chat, https:// So if you open that, okay. So I send that link to the Hispanic people so they can check on their phones resources. So for example, we have also mental health resources in that link that people can check it out, and also contact information of places for mental health. And also I have information about some of our activities. I put some pictures of some of our activities. we celebrate the Day of the Dead. Well, even in Hispanic countries, it can be different. Like where I come from, way down in South America, we don't celebrate the Day of the Dead like in Mexico, but I get very excited to celebrate with them. And we promote a dancing group, and we are dancing Hispanic music in some of our events. That's one activity that is good for our mental health, because dancing is good. You know, you are listening to good music and dancing at the same time. So we encourage our community to join our dancing group, and it's free to join. And we always have a lot of fun when we meet and dance. Okay, so we also had Yuyi Morales. She's a Mexican writer and illustrator, and she's a role model of what Hispanic people can do, because she has been awarded with some important awards as a children's book writer and illustrator, and she was here in Waso, and Hola helped with taking Yuyi Morales to some schools. And Ruben Silva, I think you dress up as one of her heroes, right?
Yes, I did dress as a luchador for the kids, and I was with Yuyi Morales and also Frank, which is a co-worker. He was also dressed as Batman and a Batman luchador, and we pretend we were fighting, and I was like making the kids laugh for a while, just for them to have a sense of what is the Mexican culture with luchadores. And yes, Yuyi Morales read a story about a kid that was a luchador, so it was a nice experience.
Yeah, so that was good for the kids to have some of our our team co-workers dress up as some of her characters from her books. There was also Frida Kahlo. Isis, one of our co-workers, she dressed up as Frida Kahlo, which is an important Mexican character. And that was very important for the kids to have a Mexican writer and illustrators, and she's a role model, and she encourages people to do what you like with passion, because eventually also, besides that, you're enjoying what you like, and you can get some money also afterwards. And so that's good for kids to learn that, and it's good for our mental health to see that type of case. And then right now we are organizing a workshop on how to start a business in Spanish, and that is going to be on April 17. It's free. We'll have also free food for people, and I think this is something good for our community. Thank you very much.
Thank you, Diana. And thank you, Rubens. That was really, really helpful, I think, in highlighting the good work that you all are doing. And this is their contact information. So if anyone is interested in learning more about the programming, if you're in the Wisconsin area and more local to Rubens and Diana, this is their contact information that I asked them to make sure that they shared on the slides. So again, I think one of the highlights from having Rubens and Diana come and speak to us is about also being able to think about how do we partner more effectively with the community organizations and community-based organizations and agencies in terms of really addressing the needs. And you saw that with a lot of the programming that Rubens and Diana and Ola offer, they are trying to target those social determinants or social influencers of health. And so one of the overarching goals is that eventually we get to a place in society where we don't have to provide necessarily as much support for those things, because we are providing the healthy soil for social determinants of health. So we don't have to bridge those gaps. But in the interim, fantastic organizations like OLA, you'll hear from some other organizations in the next two sessions. You'll hear about all the different work that they're doing to try and really fill some of the gaps and really promote health equity, because we know that, again, health is not just about your own genetic code. It's more about your zip code, where you live, your community, the resources available to you in terms of promoting that. So I'm going to stop sharing just for a second because I know there was at least a couple of questions or maybe a question in the Q&A chat that I wanted to make sure we got to, and I can see the Q&A, which is good. I'm not the most like technologically like savvy person, but I think I did pretty well today. So Amy Miller, if you're still on the call, had a question. Did you say there was an advocate network? I have families who flee to the US and those who come without birth certificates, etc. And getting the documents here is hard, or getting them insurance, etc. is hard. And Amy is located in the Cleveland-ish area, which used to be where I live. So I'll go ahead and answer this from my perspective. And then Ruben's, I will also let you answer that question as well, because it sounds like you also have some things to offer there. So from the Cleveland standpoint, so the network I was actually referring to is more of a open network that anyone who is working in behavioral health or is concerned about the behavioral health of the Hispanic and Latino community can reach out to and can attend the meetings. We have meetings every other month. So they're on I never know if that's like bi-monthly or I don't really know, bi-monthly, semi-annually, something like that. But they're every other month. And folks can attend. And one of the things that has come up a lot is being able to provide behavioral health services to those who don't have access to obtaining insurance at this time, or have, they come from mixed status families and there's some hesitation about like enrolling children in Medicaid, even though they might be eligible for a lot of different reasons, including like some of the dialogue that was around the public charge rule and things like that. So that network isn't necessarily specifically geared at obtaining those legal documents or sort of obtaining any documentation for that, but can help provide sort of insight and help with resources in connecting individuals to some of those resources if they don't have those documents. And so I can share, Amy, if you want to put in, I will actually put in my email because I realized I didn't put my contact information on these slides. So I'm going to put my email in the chat. I'm just going to put my personal email in there. And so if folks want to follow up with me for that reason or any other reason, I can help give you information for that network, Amy. We're in a little bit of a pause because we're getting a new executive director for the Ohio Commission for Hispanic and Latino Affairs. That new executive director, I think, is likely to be named in the next couple of weeks. But that is, we're waiting for her to just sort of get her feet under her, I believe, or whoever that person's going to be, to get their feet under them in their new position. And then that network will be relaunching. But definitely I can at least help connect you to some of the folks who are currently in the network and see if maybe they would have some help for you. And then Rubens, if you'd like to offer your insight into that.
Thank you, Dr. Sampillo. And this is amazing. We are connecting to help the most needed people. And that question is about one of the most needed people. I will share a website that is very helpful for me. It's called findhelp.org. It is on the chat. And you can put your zip code there and what kind of service you're looking for. And what I would like to share is that when a person say, I don't have Social Security, I don't have ID, I am homeless, I am all of sort of things, we connect them with the organizations that don't require those documentations, like WASA Free Clinic, like the food pantry, like the Catholic charities that are more than welcome to help those kind of people. And that's the short answer for that. But if you have more, if you need more clarification, please don't hesitate to write me an email. That's my email address too. It is rsilva@uwsa.edu. Thank you very much for your question.
And thank you, Rubens, for chiming in. And I think Ruben just really highlighted, the folks who are boots on the ground doing the work. This is how we hear about the issues that our community is facing. And so, and that's how the network, the Ohio Latino Mental Health Work, sort of functions, is that folks who attend those meetings are able to amplify some of the issues that they're facing. And then the goal of that network is, because it's also part and parcel of the commission, is then the commission is aware of some of those issues. And because the commission is aware and they're sort of the legislative liaison to the Ohio State Legislature, we can amplify some of those issues or put them as part of like a mental health advocacy agenda that we're trying to help amplify some of those issues for a more broad change. But we don't necessarily, I think that's, Ruben's really highlighted all the different parts that are involved in that, right? Is we want to hear from the community, the folks doing the work in the community, they know what the needs are, they're living it every day, they know what resources are helpful. And then how do you then ensure that those resources are available on a wider scale so that we are able to more largely impact families and individuals broadly. And I think that's one of the things about advocacy is, kind of making sure that we are making those connections, amplifying issues, amplifying voices, and then pushing them forward so that those voices and those issues are being heard on a larger scale. And that's some of the roles that we can play as behavioral health providers or other individuals who work in behavioral health, whether we're preventionists or interventionists or social workers or psychologists or community health workers, is trying to make connections, build sort of, and we're going to talk about this in our next sessions, but how do you build capacity to help with bringing these issues to the forefront and really able to try and make some change, not just locally within maybe your organization, but also how do you then maybe implement change on a broader scale. So we'll talk about like what we call a big A and little a of advocacy, both of those lenses. I don't see any other questions in the Q&A right now, but we do have we have like 10 minutes left. So I wanted to actually ask Rubens and Diana a question because again, they're the boots on the ground folks, living it day in and day out. Rubens, you really talked about a lot of different mental health resources that OLA can connect folks to and really like help get services to your community. I was wondering if you could talk a little bit about how you all built that network, like how you built those connections to those different organizations or to those different options, because I think that might help folks, especially in the audience, thinking about like how do they widen their resource networks and how do they make connections with folks. And so if you could just talk a little bit about how those connections were made at OLA, I think that would be helpful.
Thank you. I appreciate your questions. We have a podcast through Facebook that we interview a lot of, let's say, providers that are doing those services. And then we spread the word. And then we receive textings or emails saying, I also want to help the community. This is my organization. How can we connect? And then that way we set up an interview with that other resource. And also when we are doing events like in, let's say, Cultural Fest and other events that other nonprofit organizations are also on different tables, we try to communicate with them and say, okay, what do you do for our community? And they then speak with us about their program and what they do. And then I give my card, they give us their cards, and then we send emails, and then we set up an interview on the podcast, and then everybody knows about it, and we start promoting it. And, this is a very cool way to do it. And also, I know that because we are a nonprofit organization, Mariana, Francisco, or coworkers that are more, let's say, they are in the organization for a longer time, they have more connection than I do. And when they go to conferences in order to find more grants for our organization, they meet with very great people that say, you know what, I can also be a blessing or be a resource that you can connect with in order to serve better the community you are serving. And this is great. And also through churches like St. Bernard's Church with the food pantry and all the services that the county provides, and other nonprofit organization once every 2 months. he have another connection with other churches that also are doing food pantries, like the Presbyterian Church west of Wisconsin. There is one that is doing a food pantry too, and they can share experiences, and they can upgrade the level of service that they do on the food pantry that way. So those are some of the ways we do in order to add more resources to our organization to be connected with. Thank you.
Thank you, Ruben. Super helpful. And again, I think Ruben's is doing a great job of highlighting that whole infrastructure that they've sort of built for really trying to address those social determinants of health, right? And so while his organization may not provide all of those specific services themselves, like they may not be the direct service deliverer of that particular service or resource, but they have partnered with other entities and other resources to make sure that their families can be connected. And I think that also gets back to when we think about behavioral health, is really thinking about behavioral health broadly. And again, those social influences and social determinants. So I always recommend, so I teach younger psychologists, so psychologists in training or master's level clinicians in training. And one of the things I always try and teach them is, as much as you can, to really research and sort of explore what we call do like a landscape analysis of what the resources are in your community, so that you really understand and develop connections and relationships with the different organizations, because part of it is sometimes we're just not aware of those resources. And if we're not aware, then we miss out on an opportunity to try and ensure that our families can get connected. So landscape analysis is something that can be really important. I think Ruben's highlighted a really good point of a way that Ola and he and Diana do with advocacy is even just running a podcast, right? Advocacy can take so many different forms. You can host a podcast and really help connect people to resources. You can write an editorial piece for a local newspaper. I had a previous trainee who sent me a text the other day that she gave testimony at a local school board hearing, and she was really saying how proud she felt of herself for doing it. Absolutely, she should be proud. And then also just wanted to thank me for giving her some of the confidence to do that. And so I think that's part of, there's so many ways that we can engage in advocacy. And again, I know we didn't talk specifically about the different ways today, but we're going to talk about that as we move forward. But I think it's important to just highlight there are so many ways that you can get involved in advocacy that fit you, right? Advocacy doesn't have to look any one specific way. You don't have to go testify at the state house if that's something that's not comfortable for you. You don't have to, go to your local school board district meeting if that's not something you're comfortable with, but maybe you're more comfortable advocating within your agency or institution for changes. Maybe you want to make sure that your agency is providing more culturally competent and linguistically appropriate services. That's something we can advocate for. So really what I hope folks will start to get out of the next couple of sessions is different ways that you can engage in advocacy in a way that feels comfortable to you, while also helping you feel like you're having some level of influence or having some level of change. I think to get back to that mention I just mentioned about level of influence, that's one of the other things is I hope folks will start to walk away from this series, and maybe even today from this session, is just thinking about, where do you have influence? Because we all have some level of influence. And I know sometimes it doesn't feel like that, but I like to try and tell people to think about, what are your spheres of influence? That could be within your clinic, that could be within your community-based organization, that can be within your neighborhood, that can be within your friend group, whatever it is. There's some level of sphere of influence that you likely have, and it's about identifying what those are and then trying to use those spheres, trying to identify how we can advocate or engage in advocacy to help move that sphere of influence forward too. So again, just for some things for folks to think about as we wrap up a little bit today. I don't see any other questions. Rubens or Dana, is there anything else that you'd like to share? Any closing thoughts you'd like to share with folks before I turn it over to Jen, Isa, and Alyssa?
Thank you. Talking about the influence we can have to other people, you can use some services that you already do for your community. In my case, there is a food pantry that feeds more than 325 families per week, once a week on Thursdays. And between, let's say, noon and 1 p.m. and 2 p.m., noon and 2 p.m., I'm taking like the information, because they like park, they don't park, they do like a line of vehicles in order to get the food they need. And in that line, I go like vehicle by vehicle, like registering them in order for them to get the food they need, depending on the size of their families. And while I'm doing that, I ask them, is there anything else you need? How can I help you? And in that way, they start sharing something, because I'm sure that they are not just in need for food, they are in need of other things. And then when they start sharing those other things, then I give them my contact information, and also a brochure that's explain what OLA organization does and H2N organization does. So it is good to have that influence on people, that because they you are building like trust, because you are helping them without asking too many questions, and you are saying, what do you need more, because there are services for you, and they are also not requiring you to have a documentation to show in order to receive those services you need. So that's important, and thank you for lighting that up, Dr. Sampillo, and thank you for inviting me. Have a blessed rest of your day, everyone. And Diana, I don't know if you want to share some words.
Well, just thank you very much for this opportunity, and I'm looking forward to listen to the other parts.
Thank you so much, Diane and Ruben. Your perspective has been invaluable, and you highlighted such great things. I think just to close, Ruben's, you're mentioning how like in that 2-hour time frame when you're asking them questions about the food that they need, you're also asking just like what else do you need. I think you just highlighted sort of the central piece of advocacy is really trying to understand what the needs are, and sometimes we have to ask. We just have to ask, and I think that's actually one of the first things I tell people is, when you think about just like your first step in advocacy, is just notice gaps. Like, where are the gaps? Start asking questions, bring things to people's awareness, even if it's like, I noticed that maybe our Hispanic and Latino families aren't coming back for their second appointment with mental health. What are we doing about that? I noticed that my Hispanic and Latino patients, it's really hard for them to schedule their appointments in my chart for whatever reason, right? Like, whatever you're noticing, starting to ask those questions broadly and see like what's being done to address maybe some of those gaps. That's sometimes where advocacy starts, is just asking the questions and understanding the needs, like Ruben sort of highlighted. So with that said, I'm going to turn it over to Alyssa, Jen, and Isa. Again, I want to thank you all for attending today. And I hope that you'll join us for our next sessions. And we're really trying to push this advocacy thing because we know it's so critically important. So thank you for your interest, and thank you for being here today. And so Jen, I'll turn it over to you.
Yes, thank you. I echo Marilyn. Thank you everybody for being here. We hope that you sign up for parts 2 and 3. Those registration links are in the chat. Part 2 is on May 14th. Part 3 is on June 25th. And you will automatically be redirected to a very short survey. These surveys help us receive our funding to be able to put on these free trainings for you all. So we really appreciate you taking just a moment out of your day to fill that out. Certificates of attendance will come to your email. Keep an eye on your junk and spam. It should be there in the next couple of days. And reach out to us if you have any other questions. Otherwise, we hope to see you May 14th. All right, bye everyone.